Why do you think it's so hard for people in Ireland and UK to get access to dental implants?
Three reasons. The first is cost. Implants are currently way too expensive for 99% of people. The second reason, we've reduced cost drastically. We do intravenous sedation, conscious sedation, oral sedation, nitrous oxide sedation, general anaesthesia. We have a large amount of dentists who are trained to do implant dentistry. We also do payment plans. We're open 8 a.m. to 8 p.m. and we're open on weekends. Do you have intravenous or nitrous?
I've had both before. The nitrous makes you feel like you're floating on clouds, and then the intravenous is just like you don't remember anything.
Photogrammetry is an alternative to gooey material which goes in your mouth and causes you to choke. It's just a camera. It digitally measures the position of the implants.
Regardless of what package someone picks, we always deliver same-day teeth. That's our core principle.
Revenue will give you 20% tax back on the implant, so that's the portion which costs €499, and on the implant crown, which costs €451. So in actual fact, your out-of-pocket cost will be about €800 all in.
If we can charge €950 for the core implant, why don't other dentists do this? How can you charge so low?
So do you guys want to start with the stuff of like, Mo asked Jimmy about his background.
Oh yeah, okay,
Jimmy
sure,
asked
yeah.
Mo about his background. And then we'll kind of...
Yeah, exactly, yeah. Because the first thing we want to do is just establish credibility. So if you're launching a new product or service, who are you to have the audacity to do so? So we want to tell the audience about our background and passion for implant dentistry. Okay, so you let me know when you're ready.
Ready?
Okay, yeah. So Jimmy, do you want to tell the audience about your background? So where you studied, where you did your undergraduate studies and postgraduate studies?
So I did my dentistry in Trinity in Dublin, and following this I spent a year as a house officer in a dental hospital. So I was one of the top 6 students in the class, and in that I got kind of a lot of exposure to implants and kind of people who were missing teeth or had no teeth, so specialized cases like hypodontia, metagenesis imperfecta, these kind of things. Following that, I went to the UK for 2 years, and initially I worked in Chichester, which is a centre of excellence for soft tissue surgery. So over there you kind of did a lot of skin cancers in the face, the head, the neck, thyroid surgery, exposure to all these kind of things that you never really thought you'd do as a dentist. And then after that I was kind of still hungry to do more, and it was peak COVID time, so I went to Cardiff, which was the main unit in almost all of UK for cancer surgery. So over there I did facial reconstructions, did bone grafting from the leg to the face, did skull-based surgery, did what are called craniotomies, where you cut people's skulls, you cut a chunk out of their skull to reduce the pressure in their brain, and then also reconstructions with zygomatic implants for cancer patients as well. After this I came back to Ireland and I did medical school in Trinity College Dublin again. So now I'm qualified as a double doctor, or as everyone calls me, doctor. And then in terms of my implant surgery, myself and Mohammed did a lot of the similar things. We did training in the US with Dr. Garg, so as part of his continuum. We did zygomatic implant training with Dr. Salvoni in Brazil. I've done a postgraduate diploma of implantology from UK as well. And I'm also a fellow of the International College of Oral Implantologists. So I love implants, and it's all we kind of focus on, and that's why we always want to learn more and do more. So Dr. Shirin, tell us about your background and training.
Yeah, so I did dentistry in Trinity College Dublin. I graduated in Dublin and then went to the US and did a fellowship in Florida. I then returned and did a master's in implants in Germany, which gave me kind of a broad understanding, a broad approach to implants, both on a European level and kind of what's done in the US. I then founded Truly Dental and also Boris Dental Labs because I have an incredible passion for manufacturing and engineering and innovation. So I'm a member of the Royal College of Surgeons in Ireland and a fellow of the International Congress of Oral Implantologists in Europe.
So why do you think it's so hard for people in Ireland and UK to get access to dental implants?
Yeah, I think there are 3 reasons. The first is cost. Implants are currently way too expensive for 99% of people. So yes, 1% of people can afford implants at today's pricing, but 99% of people cannot. The second reason is fear and anxiety. So patients are afraid of pain, they're afraid of the surgery itself. And thirdly, the supply of surgeons, so dentists who are trained to do dental implants. So we focused on targeting all three problems, and we're incredibly proud of that. So we've reduced cost drastically. We do intravenous sedation, conscious sedation, oral sedation, nitrous oxide sedation, general anesthesia for those patients who are afraid. And thirdly, we have a large amount of dentists who are trained to do implant dentistry. So because we're incredibly passionate about implant dentistry, we've been able to attract like-minded clinicians, upskill them, support them, train them, and facilitate as much treatment as possible for as many people as possible, starting from the most basic of implant treatments to the most complex. So,
and what's the basis of cost of implant being so high at the moment? Like, what drives that?
Yeah, there's actually fundamentally no good reason, and this is the incredibly kind of frustrating thing about implant dentistry. So in some ways it's our challenge as dentists, or our fault that costs are so high, is the component fees or manufacturing fees are low. So if we can master manufacturing, which we have done, we have our own factory where we make the teeth, we're able to take those savings and then push them on to patients and allow as many people as possible to afford implant dentistry. We have a lab which manufactures more implant restorations than anyone in the UK or Ireland. So we're able to negotiate good deals with our suppliers, reduce costs, and push those onto patients.
And what's Truly's goal here? Like, what is the end point for Truly?
Yeah, well, we've introduced this Core Implant. The motivation behind it was, as you know, we treat a lot of medical card patients, and we have gotten so many questions around whether or not the implants are available on the medical card, and unfortunately they are not, but many patients need them. There is quite a clear paper on the standard of care for a lower dentures patient. So a patient who has no lower teeth, they should be receiving at least 2 implants, not a complete denture. So we want to help as many people as possible, and in order to do that, we have to reduce the costs drastically, make sedation available for those patients who are afraid, and then train as many surgeons as possible. So we need more dentists doing implant dentistry.
So do you want to talk to us about how technology has changed every industry bar dentistry?
Yeah, so technology has made every industry efficient, and that efficiency has resulted in reduced cost, because you're able to get from A to B faster, more predictably, and typically with less human input. So the one industry that has been resistant to change, or extremely resistant to change, is dentistry. And there are kind of several reasons for that. One is that dentists are kind of comfortable in what they're doing. There isn't a huge amount of motivation to change or necessarily learn new technologies. Secondly, the undergraduate curriculum isn't based on technology, so we receive a lot of training on biology, chemistry, medicine, anatomy, but not necessarily computer science or IT, whereas the technologies that are coming on board now, such as CAD/CAM, computer-assisted design, computer-assisted manufacturing, 3D printing, additive manufacturing, subtractive manufacturing, sintering, layering, none of these topics, all of these topics are essentially engineering. It's broadly classified as engineering, whereas dentists receive no training on that. So the profession as a whole hasn't onboarded all these technologies, but the parties which are suffering are dentists, because they're inefficient, and then also their patients, because they don't benefit from these technologies. So this is something we are incredibly passionate about, technology and onboarding technology, but predictably. So we want to know that something works 1,000% before we ever kind of go live with it, and it is changing our industry and making everything more efficient, and we're seeing is cost savings, which we're pushing on to patients.
So we've talked about why implants are so hard to get in Ireland, but what are we doing, or what are Truly doing to change this?
Yeah. So we want to tackle the 3 main obvious problems. So we've reduced cost to facilitate implants for as many people as possible through the Core Implant. We offer sedation, both intravenous, oral sedation, nitrous oxide sedation, general anesthesia. We offer all types of sedation, and we have implant dentists in all of our locations who specialize in implant dentistry. Apart from that, we also do payment plans, because even at an affordable cost, we want to allow our patients to split out those payments. Our opening hours are also convenient for patients. We're open 8 a.m. to 8 p.m. and we're open on weekends as well, is on Saturdays and Sundays.
You work on people hard, huh?
Yeah, we love implant dentistry. Yeah. Then we have very clear and transparent pricing on our website. So we commit to our pricing, and it does not change. So once you receive a quote, we will stick to that quote, and there are no hidden costs. On top of that, we also offer free consultations. So there should be no reason why you can't come in to get a quote and to be educated on your needs. So we will listen to what you are hoping to achieve and then tailor the plan to yourself. So I actually have an implant in my mouth. I had a bad accident, and I thought through the entire process as a patient myself to think through, okay, what made it difficult for me is, and we listen very carefully to our patients. So I think we've addressed almost everything that we can think of, and we are constantly looking to see how else we can improve.
Where is your implant?
Oh yeah, it's at the front of my mouth here.
You can barely even tell, right?
Yeah. I actually had no tooth for about 6 months.
Terrible dentist.
So it was kind of, I was wearing like a removable, it was like a denture. It was pretty awful. It was one of the motivating factors behind. It was also incredibly expensive, even though a buddy of mine did it. And I'm not blaming him, because his costs were incredibly high. He actually shared with me I was a dental student at the time. He shared with me the costs of the implant, his laboratory fees. Just, in hindsight, just outrageous. So how does sedation help facilitate more implants for more patients?
So one of the things about implants people often find is that they're quite scary, because there's this thought that someone's going to put a screw in my head, and all the fears that come with that, and all the kind of ideas of surgeries and needles and stuff. The concept of sedation is it's medication designed to relax you. Okay, so one of the beauties of sedation is, one, you get relaxed, so that makes it a little less scary, and two is you're a little less aware of what's going on, and also there's a slight pain relief effect as well. So anything you feel before the anesthetic is kind of taken away as well. On top of that, one of the beauties of sedation is the day after you don't remember. So
it causes you to forget.
So when you forget what the experience was like, and we still treat you really nicely while you're there, but when you forget what that's like, that whole concept is you had the implant done, you have no pain the next day because the medications you have are quite strong, and then you don't remember it. Just makes that a bit more of a nicer experience compared to what dentistry was like before, where there was always this fear, the stories you hear about knees on chests, and couldn't pull my tooth out and all this kind of stuff.
Particularly because the way a lot of patients who need implants have not been to the dentist for many years, and they have a lot of mouth troubles, and they're afraid that the procedure is going to be a big procedure.
I've had sedation, and I can say it works well. Not well, it works great.
Did you have intravenous or nitrous?
Yeah, I've had both before. The nitrous makes you feel like you're floating on clouds, and then the intravenous is just like you don't remember anything, because I remember I was there, and then when I woke up the next day, that's the next thing I remembered. So it's great.
It's actually also why you need an escort, because you won't remember how you got home. You won't remember typically even being at the dentist. So this is actually quite scary. So that's why it's critical that you have an escort.
What's photogrammetry?
So photogrammetry is an alternative to gooey material which goes in your mouth and kind of causes you to choke. Some people can't breathe with it in. Some people are claustrophobic. So it's an alternative to that, where it's just a camera. It digitally measures the position of the implants. So there's no need for the gooey material.
Is it better?
Yeah, and that's thank you actually for asking that, because it's a piece of technology which is not only a lot easier for patients, but it is also faster, and it is also better. So it's quite special when something is easier, faster, and better. And that's why we love technology. So why do you think other dentists aren't doing it?
I think you have to really have a passion for technology, and you want to learn. So one of the reasons that we can do this is because we love the technology side of it, and we've gone out of our way to learn what's better and what's the standard of care. Sure. Maybe some people in dentistry, quite often you get comfortable in what you do and how you provide it. So there's that, that fear of the unknown in terms of learning more, right? So I think the fact that we're hungry to learn more always means that we can push this technology into our workflows and therefore give our patients better care. So we mentioned 3D printing a lot. How do we use that in our day-to-day dental practice?
So we have 3D printers, as you know, in every single practice. So we're able to use those 3D printers to give people teeth the very same day of surgery. And they are nanoceramic, strong teeth, which are white, they look good, and they are extremely accurate. So yes, there is a learning curve to 3D printing, but our patients are benefiting tremendously from it.
And is it only for making teeth? Is there other aspects we use it for?
Yeah, no, we can 3D print patient models to show patients their teeth and actually their skeleton sometimes. We can make night guards from
actually, that would be a good idea.
Yeah. So this is 3D printed. Actually. So this is a 3D printed model, for example, where we had a patient and we were able to print that section of their skeleton to show them and educate them on what areas in their mouth they're missing bone. And we can 3D print night guards, pretty much kind of any shape, actually. So the world's your oyster, as long as you know what you're doing.
You're launching this idea of Core Implant, which is supposed to be cheaper and more affordable. What's the basis behind this?
So the Core Implant is 499 euros for the implant, and it's 451 euros for the tooth that goes on top, for a total of 950 euros per tooth all in. The idea behind the Core Implant is that currently in Ireland, implants are way too expensive. So implants are on average 2,500 euros, and that is far too expensive for most patients. So we want to give patients an affordable solution that we guarantee looks good, functions well, and is a perfectly good solution.
If we can charge 950 euro for the Core Implant, why don't other dentists do this? How can you charge so low?
So because we manufacture our own teeth, we're able to take those savings and push them on to patients. And we offer 3 separate prices for patients depending on what they are looking for.
Could I get a Core Implant anywhere in my mouth, or is it designed for a specific area?
Yeah, so bear in mind, we launched the Core Implant as to service the demand from our medical card patients. So medical card patients who wanted an affordable solution. So if you're looking for a tooth at the front of your mouth and for it to be perfect, because typically, you know, when you're smiling, the first thing people see is your front tooth, we would not recommend the Core Implant. So I would go for an advanced or a premium solution. Is if it's a back tooth and all you're looking for is for function and for something that is reliable and will work for many, many years, Core is completely fine.
And what sort of guarantee do you offer on Core Implants?
So we offer a 20-year guarantee, same as our advanced and premium solutions.
And is there any kind of conditions to this guarantee? Like, what do I have to fulfill?
Yeah. So we do insist on a once yearly annual checkup. So I've done implants for patients, 6 years ago who I haven't seen since, and we follow up with them, we email them, and they tell us that, look, everything is fine and I don't need to come in. But we like to see all of our patients once a year to check up and make sure everything is fine, and that guarantee is contingent on that. And it gives you peace of mind knowing that everything is in fact fine.
And we're often telling patients that they're able to get 20% tax back on their implants. Does that apply to the Core Implant as well?
Yeah. So revenue will give you 20% tax back on the implant. So that's the portion which costs 499 euros, and on the implant crown, which costs 451 euros. So in actual fact, your out-of-pocket cost will be, about 800 euros all in.
And if I get a Core Implant, how different is it going to look compared to an advanced or premium implant?
So our treatment coordinators will show you examples of Core versus advanced versus premium. But think of Core as a kind of a sturdy Toyota. So it's not the most luxurious car in the world. So it's not a Ferrari or a Lamborghini, but it is extremely functional. It will look good in your mouth. But if you're expecting a Ferrari, you're not going to get it at that pricing.
And does the Core Implant include grafting, both bone or like gum grafting?
Yeah, so if you do not have enough bone or gum, we can always build that up again, but it is not included in the cost of the Core Implant. And your dentist we're incredibly proud about our transparency. So we will give you a printed out plan before you start anything. We will take a 3D scan, a CBCT, a cone beam scan to assess how much bone and gum you have in the area. Once we've done that, we will give you a customized plan. But the vast majority of patients actually don't need bone and gum grafting. So most patients, thankfully, do not need it.
Can you have a payment plan for Core Implant?
Yeah. So we do not do third-party financing through Core Implants. They are already incredibly affordable, and we're incredibly proud of that, but there is no margin built in for third-party financing. So you will be asked to pay half of it at the time of surgery, and the other half typically 2 to 3 months later, a week before you get your tooth fitted, which in some ways is a payment plan actually, which we do, in-house. And will patients get a screwed-in set of teeth the same day? Same day as surgery is done.
Irregardless of what package someone picks, we always deliver same-day teeth. That's our core principle. That's our core package.
Okay. So can you just briefly talk about the 3 different packages? So
we've got the True Smile Core, €6,500. So that includes 4 implants and 10 to 12 teeth. And what that is being able to restore your smile, giving you the ability to eat at a more reasonable price than has ever been offered before for this treatment in Ireland. Okay. The advanced package is for someone who maybe wants to tailor their smile a bit more themselves, where they have input in the design. They'll have 12 to 14 teeth, and that includes as many implants as they need, and also some grafting as part of that as well. And then the premium comes with this idea of hand-layered, individually designed porcelain crowns. So the person's smile, they get to choose down to a T, to a micron, what it looks like, the naturalness, the aesthetics, all these kind of things that come as part of it.
So for the Core, there is no design input from the patient's point of view. So we will design a set of teeth which we feel looks great on the patient.
It's functional, so it's recreating a smile that's there to last, that they can eat with, and that we provide a guarantee on.
So with the True Smile Core, is sedation included or no?
So sedation is not included. There's a separate charge of €250 for that. But as part of the core package, you're restoring the smile. So these things are small add-ons that you may or may not need, but they're always there and available.
Okay. Do we offer the True Smile Core in every location, or will patients have to travel depending on availability?
The reason we provide same-day teeth is, and the reason we want to provide True Smile Core is that we want to give back to as many people as possible. Some sites may be busier than others, so it's harder to get an appointment there. So we may ask patients to travel to one of our other nationwide sites.
So they don't have to wait as long.
So they don't have to wait as long. They can get their teeth straight away. Because we have 3D printers and photogrammetry on every site, we can provide teeth from every location, and that way we're able to provide the True Smile at every site. So your treatment coordinator, who's like your navigator on this journey, may say, hey, your surgery is going to be in this site, you just have to spend 1 day there. That's it. So you go, you have your teeth fitted, and then you go and you're gone home. That's it.
And most, sites are within kind of an hour drive of each other anyway.
Nothing's ever too far.